Fred was a guest of the Bonati Spine Institute over 9 years ago. He's an active man that enjoys gardening and going to the gym.
I'm in real estate. I own several shopping centers. I buy properties and just doing like that. I used to be in a furniture business a long time ago. I used to import from Far East a lot of different furniture to US, and I sold it here. But I did that for around 10 years. I sold my business. I'm more in real estate business now. I was doing playing soccer before. You know, when you play soccer and you get hit, different players, at the end of the, just the old age, it come back to you, everything, all the problems.
Nearly a decade ago, Fred noticed an escalating pain in his lower back, making it increasingly difficult to walk and work.
I used to have a pain on my lower back, and I couldn't just really walk that much. Right there on my hip, it just stayed there. But sometimes it had a very sharp pain, just comes and goes. In my business, I had to travel a lot to overseas, and it was difficult for me in the plane because with the pain. When I was sitting or standing up for a while, and the pain was there. When I was sitting, after standing up, when I was sitting, the pain was going down a little bit. And I had to take it easy. Sometimes I have to lay down, and the pain goes away because I didn't have no pressure on it. It was zero gravity when you lay down. But I couldn't deal with it. Yeah, I could walk or stand up 10 or 15 minutes. I had to sit down after that. If I was standing for 15 minutes, I had to sit down. Or if I was walking, I had to do the same thing. I have to sit down just to let the pain go away.
Fred sought help from a chiropractor, but quickly came to the realization that the pain relief he got from those treatments didn't last.
First, I started with the chiropractic. I went to a lot of chiropractor. Didn't work, didn't do the job. They give me some device, just to put on your back and just pump it. Those didn't work, because if the problem is physical, you have physical problem, you have to go take care of that. It wasn't just like a muscle, just inflation of the muscles or anything else.
Fred learned about the Bonati Spine Institute from a friend and started doing his research.
He's a very good doctor, but I researched myself about him. I read a lot about it, I find out he's a very skilled doctor, very professional. He knows what he's doing.
Based on what he learned, Fred decided to schedule an appointment for an in-person evaluation. During that examination, he had updated X-rays and MRIs performed at the on-campus imaging center.
I had my imaging, but I had to take it there too. And I saw Dr. Bonati because it was just like I went to him straight.
Later that same day, Dr. Bonati met with Fred to review his images and outline a surgical plan which included 2 targeted Bonati spine procedures at the L4, L5, and L5S1 areas in his lumbar spine.
He was showing me just there is a problem on lumbar 4 and 5, and my disc was bad in that area. Before I do some things myself, I just do a lot of researching myself. I trust myself first with my own knowledge. But when I went to him, he had super knowledge on that field, and he educated me. He said, this is the thing you're gonna do. And I listened to him, and that was a great advice from him.
The exclusive Bonati spine procedures are performed incrementally using conscious IV sedation. This technique allows the patient to remain awake and communicating with the surgeon, ensuring their source of pain is eliminated before they leave the operating table.
I was awake. I was looking at the monitor myself too to see what is he doing, but it wasn't that bad. And he was talking to me during the surgery, and it took probably like half an hour, something like that. He knew what is he doing, the back surgery, you just don't give your back to any doctor. You have to give your back to the doctor, he knows what is he doing. And you don't find too many surgeons like him. And I feel so good. I really feel so good.
An additional benefit to the Bonati spine procedures is they dramatically reduce the risk of infection and blood loss, and it allows for the body to recover faster because the incisions are smaller than those of traditional open back surgery. Because of this, Bonati guests are often surprised that they can return back to work in their normal routines in just a matter of days.
After surgery, I had like for a couple of days, just wasn't 100%, just because, after surgery. Actually, I went back to work probably the next day after that, After that, I went back to my normal life and to gym, just did slowly exercise on my back area because I didn't want to hurt myself. But I went back to normal.
Following surgery at the Bonati Spine Institute, guests are instructed to walk at least a few minutes every day to aid their bodies in the healing process.
And after that point, I was fine. He did like a miracle, for me. I felt good. I really felt good.
The Bonati Spine Procedures offer lasting relief, allowing the body to retain its natural mobility and flexibility.
It's been around 9 years, and I really I love going outside to gardening. I just love nature. And before I couldn't bend over just to pick up some weeds or do something, but now I feel really good.
Now, 9 years later, Fred is still living pain-free and highly recommends anyone suffering from neck or back pain to contact the Bonati Spine Institute.
When I advise anybody is having this problem, just go for it. Just don't hesitate, because if you lose your quality life, it's hard to survive. If I cannot go to gym, five times a week, if I cannot travel, I cannot go here, there, I don't have my quality life. I want to thank Dr. Bonati, and God bless him.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store.